Receiving a cancer diagnosis is a difficult journey. If you're living that right now, you know your life has turned upside down, and finding the right treatment can sometimes be just as difficult. Well, today, surgical oncologist Jill Onesti from the Mercy Health Lac Center is here to share a new treatment that can help those who have received this difficult diagnosis. Good morning, Jill. How are you?
Good morning. Thank you for having me.
Well, thanks for being here. So the word that we're going to talk about, or I guess it's maybe an acronym, is Hipec, right? H-I-P-E-C. And for those like me who haven't dealt personally in my immediate circle with cancer, I'm sure my mother and my sister, but my immediate family, so I don't know what Hipec is. I've never even heard that term. Can you explain to me what that is?
Well, that is very common. There's just a huge lack of awareness of Hipec, both in our medical community and in the general population.
Okay.
Hipec stands for heated intraperitoneal chemotherapy.
Okay, so it is a type of chemotherapy.
It is a type of chemotherapy, but it's not just chemotherapy.
Okay.
It's a very specialized procedure. It is a surgery where we go in and we make a large incision, and our goal is to remove all sites of cancer. We look for cancer, we feel for it, remove it from all areas within the abdomen and pelvis.
Okay.
After all the cancer is out, we bring up 2 catheters and we close the skin over top of these catheters. We then connect these catheters to a circuit so it establishes a flow of fluid. We can control the fluid that's in there, the rate of flow, the temperature, and then the type of chemotherapy that we want to add.
Okay. So can I ask a question? What is the most significant difference between what most people think of when they think of chemotherapy, sitting in that chair and getting the needle in your arm, and Hipec?
Absolutely. So traditional chemotherapy is given through your veins. Most people end up having a port that's placed usually up here.
Sure.
And that chemotherapy goes into your bloodstream and travels throughout your entire body,
right,
affecting every cell basically throughout your entire body. The difference with this type of treatment is that we are trying to reach cells that are sitting on the outer lining of your organs, and they're just not reached real well with the traditional IV chemotherapy.
Okay.
So this chemotherapy goes directly inside the belly at the time of surgery and directly touches the tissue that's at highest chance for cancer coming back.
Excellent. So I'm assuming with that type of treatment, better results come out of that because it's more localized, more kind of laser precision.
It is certainly more directed toward that exact tissue. Traditional chemotherapy just does not have great results for these types of cancer, and that's why Hipec is such an important topic, and we really want people to know that they have this option that can make a tremendous difference long term for them.
Now, is this option that you're talking about available to all? Who's a candidate for Hipec?
So there are certain types of tumors that respond better to this treatment than others.
Okay.
Hipec primarily is used to treat cancers of the appendix, colon, rectum, and mesothelioma of the abdomen. There's more interest in research being generated in treating ovarian cancer as well.
And besides the actual results that it gives, other benefits for this type of chemotherapy?
The main benefit is the difference in long-term outcomes. It is a major procedure for patients to undergo, so it's not something to take lightly, but it is an option rather than just having what we call palliative treatment or treatment that we don't think can cure.
And we're using this also for research and for other types of treatment, right? Can you speak to that?
Well, this is a really exciting time for research in the Hipec community. There's a lot going on nationally and internationally. But Michigan has a pretty unique group of surgeons and practitioners in general. This Hipec procedure was previously offered at only 1 or 2 highly specialized centers, and now there are 8 institutions in Michigan alone that offer this, which improves patient access. So the surgeons at each of these institutions have come together just within this past year, and we've decided that we want to make a very concerted effort to improve patient care and quality outcomes. So we have a new group called Michigan Hipec Oncology Collaborative, or MHOC, and our goal is to have a standardized approach so that patients can know they're getting appropriate, equal treatment wherever they go, close to their home, and then to really look at our quality outcomes and see what we can do as a group, as a state, to improve patient care.
Always a pleasure to have you in studio to learn. It's always educational. Thank you so much for the information, Jill. And of course, we're blessed to live here in West Michigan where all of these great treatments are available on the cutting edge. Mercy Health Lac Center is at 250 Cherry Street Southeast in Grand Rapids. If you want to find out if Hipec is right for you, please pick up the phone, 616-685-6714, and have your questions answered.